The goal of Long Life Med is to provide care for their patients every step of the way. They want to be a provider who knows your name and what's going on, as opposed to one who only sees your chart. I stopped into their office to learn more.
When I first walked in, I felt like it was kind of like a family environment. I felt like I was walking into almost like their living room, and I felt very comfortable, especially when you are experiencing like kind of health issues that you're not familiar with.
Here at Long Life Med, the focus is you as the patient. I'm hanging out now with David Linton, and let's talk about why you decided to create Long Life Med in the first place.
Thank you, Nicole. I wanted to create a clinic where patients get substantial treatment and feel known and understood by their provider at a reasonable cost. We have both primary care and urgent care, and we have same day and next day appointments because I personally feel delayed care is denied care. And we want to treat people in the moment when they need us the most, and that's where we're at with Long Life Med.
What are some of the things that you're able to do here in-house?
We handle primary care, also handle urgent care. We feel that your urgent care needs shouldn't be handled by a stranger, so we can do IV fluids, which most urgent cares don't do in town. You have to go to the ER for that. We also provide services for hormone therapy, red light therapy, EKGs if are needed, IV medications if they're needed, and we have a pharmacy that wholesale prices directly in our clinic. We do functional medicine, and that's going to the root of the problem for each of our patients.
Now, your model really includes longer visits for your patients. It's all for good reason, though. So let's kind of take a look at what those visits look like.
Well, usually a standard initial visit is going to be 1 to 2 hours because we're trying to fully understand the patient. It depends on how complex their medical history is. We don't have any appointments that are less than 30 minutes unless it's needed. We have televisits, and then patients can call and text questions and get a response in minutes rather than days. And we see people same day or next day when they need us for an appointment.
You have a limited amount of patients, but it's for a good reason, like we keep saying, because you really want to make sure that they get the care that they need. So let's talk about how those memberships work.
So yeah, we have patient members. We have a maximum roster of 300 so that I know any patient that calls in and has a question or when they're coming in. For example, if a person calls in and says, I have chest pain, I know their background and whether or not they're a high risk and have them come in and be treated here. If there's an issue with going to the hospital and that type of thing, we try to prevent that from happening, saving them money, stress, and a lot of different factors that are not good in healthcare right now. They really like our open communication model where they can text and call, follow up anytime, ask any question. They feel like they're being treated like a person rather than a task that needs to be done by the provider, because we don't have rush visits and they feel comfortable. It's well, like your neighborhood doctor is back that understands you.
So more time, better access, and a provider who knows you. That's all here at Long Life Med. To learn more about Long Life Med and their memberships that start at just $100 a month, you can call the number right there on your screen or visit them online at longlifemed.com. You can also check out their social media pages for all of that too.